Hi, yes, so we are back in shooting part 2 of Mock 28. In the previous video, as I wanted to continue, my son entered, and yes, then I had to stop. So, anyways, let's start. So, another question is patient is drinking daily lemon water concentrated with a straw. So, which areas would be eroded? Which areas of the teeth would be eroded? Lingual surface of maxillary teeth and occlusal surface of mandibular teeth. Only label surface of maxillary teeth, only mandibular teeth lingual surface, no surface as patient is drinking with a straw, label of maxillary anterior and lingual of mandibular posterior. So these are the options. Now for this I found a very good article which I would like to share with you all. If you can see this article out here, it's basically sports drink and dental erosion. I have again shared this article with all the candidates in my enrolled group, but for those who aren't, you can just find this online. Now here I want to see you all this picture and I want you all to read this particular line. Where is it? Yeah. The method by which sports drinks are consumed during exercise may also contribute to dental erosion. During athletic events such as cycling, cross-country skiing or trail running, liquids are often consumed by sipping from a water bottle or from increasing popular hydration packs where fluids are sipped in small quantities through a tube. Drinks that are sipped or swished have greater erosive potential because the teeth are subjected to a lower pH for a prolonged period. Conversely, gulping drinks resulted in much smaller changes in pH. So basically, when you drink with a glass, you're technically gulping it. So that causes less decrease in pH compared to constantly sipping it. When you sip, it's a slow process. It's not like a fast gulp like having from a glass. So the straw is in your mouth and you are just sipping it slowly. So because the straw is first of all inside the label surface of the upper and the lower teeth, the label surfaces are not that much affected. But what is affected is, and even when you swallow, it's the tongue which touches against the palate, and that is how you're supposed to swallow. The entire fluid accumulation is mostly on the palatal surface of all the maxillary teeth and the occlusal surface of the mandibular teeth. So the answer becomes lingual surface of maxillary teeth and occlusal surface of the mandibular teeth. I really want you all to go through this article. It's a very nice article, and even if you see here the picture, the palatal surfaces are eroded and the label surfaces are very nice. So yeah, this is how it is. So remember this. Again, various questions can be asked on this topic as to which surfaces won't be affected. I can also rephrase this question as which surfaces will not be eroded, and then my answer would be maxillary labial and mandibular labial. I can also say this. Again, I can make a question like if the patient is having acid reflux, which areas would be eroded and which won't be eroded. So with regards to erosion, consistently questions have been asked. So open your chapter on erosion. Understand what erosion is. Understand by which method, which areas will be eroded more. Okay, this is very important topic. So read about it. Next, now this is an entirely a new question which you didn't expect, neither did I, but then it was asked anyways. The use of botulinum toxin and dermal fillers by dentist. So here I directly went on to the dental board and they have a good line work of dermal fillers by dentist. Please read. But just for your information, just to solve this question, I have just opened this summary out here. So the board expects dentists to practice within this regulatory framework at all times, including when using botulinum toxin and or dermal fillers. The scope of practice registration standard, you can click on it, another new page will open it. But the line that I want you to remember is botulinum toxin and dermal fillers should only be used if the treatment can be justified. So it doesn't say that you cannot use it. It says you can, but only if the treatment is justified. Informed consent, including financial consent, must be obtained. So it's not just any verbal consent, it's an informed consent, as you have informed You have to make sure the patient has understood and you have signed on it. That's an informed consent, including financial consent. So you should also make the patient sign a paper outlining the cost of the treatment must be obtained and the risks associated with the treatment explained to the patient and documented. So you have to do all this paperwork. Once this is done, and if the treatment is justified, then you can proceed. Dentists need to be particularly aware of the patient's expectations regarding the use of toxin and dermal fillers. Dentists must communicate effectively with the patient to ensure that they are understood and that the patient's expectations are reasonable. So all these things needs to be done, and I want you to read a lot more. What is off-label? When the dentist is going to refer a patient? Can a dentist delegate the administration of botulinum toxin and dermal fillers to someone else? I'm sure this can be an also MCQ question. The answer for that it is not. They cannot. But if they are doing so, then they must take full responsibility for the receipt, security, and administration of the scheduled medicines. Okay, I want you to read through this article. Again, I have shared this article to all my candidates. For those who are appearing for this exam, you can just copy this link, paste it, and go through this. Coming back to the question, the use of botulinum toxin and dermal fillers by dentists, the answer is it should only be used if the treatment is justified. The rest of the options are not correct. What are the rest of the option? It's an aesthetic procedure and the patient should be referred to GP. No, you can do it if you know how to do it and if it's justified. They can be used if the patient request for it. No, just because the patient is requesting, you should not do it. I know the world is making off money by the patient's request. The patient will come and say, there is this wrinkle line and there is that wrinkle line, and just get it done. No, you should do it only if it is justified. Dentist can delegate the use of dermal fillers to the dental hygienist if she has adequate training. No, it has to be handled by you. Dentist can use the dermal fillers with a verbal informed consent. No, it has to be a properly documented informed consent with the associated risk and the financial part a part of the consent. So yeah, the rest of the questions I think I've already shared with the group. So these were the 4 questions, 2 in this part 2 and 2 questions in the part 1. I wanted to make just a single video, but yeah, whatever happened. So yeah, best of luck for the exam, and I'll try to shoot more videos. Just many things are happening. This year has come with its own set of challenges in personal life. So yeah, just managing through that. I myself right now I'm down with a bit of fever, so didn't leave my son to nursery today. Hence he was at home and he managed to come in when I found a short time just to shoot a video. It took me a long time to prepare this mock 28 because it was so difficult to gather questions and then all the options. It takes Herculean tasks just to make sure that you guys are given the right question with the right options and the correct answer. It's your life at at stake. It's your hard work at stake, and if you're in the limited time that you have, if you choose to follow my videos and my course content, I also feel responsible that I should give you which is actually worth it and not something random. And that's why I don't unnecessarily advertise or do something. I just practically stick to the content of it and try and help you out as much as possible, because that's what the profession is about, right? You do the right thing. Anyways, thank you for all the emails. On a daily basis I get at least 10 emails from various dentists across the globe. I just love to read, and I genuinely thank you all for the appreciation. I may not be writing that. It sometimes becomes very difficult for me to respond to everything, but I do accept your appreciation, and I'm thankful to you when you appreciate, saying that we watched your videos and it's really helping us out, and you're one of the genuine people who are just teaching properly. I do understand that. I do not want to make money off you. I really want to help, because be the change you want to see. If I want people to help, even I should be the one to help out, right? And if I've been given this opportunity by God, then I feel responsible for it. So anyways, I hope everything goes fine now. My son is due for a small procedure this Saturday under general anesthesia. I know it is such a thing. I myself give general anesthesia to children as old as him. But yeah, now it's my own son under it. You have to do some testing for something. I hope to God that everything comes out negative. I don't want to see anything out there, but it is what it is, and may God give him the courage to go through. Uh, yeah, so it's been very tough personally, actually, since the start of this year. But yeah, God's been kind. He always gives help, like situations that can be fixed. Nobody wants hardships, but yeah, when it comes, you just have to go through it. Yeah, about that. So, all right, go ahead, go prepare for your exam. If there is any doubts, leave me a message. Yes, I'll be just sitting now. I have some time. I'll accept all the Facebook requests. Correct? So, take care. Bye bye.